Welcome back, welcome back, welcome back. Hello, everybody. I am Joseph Ward, and this is Mind Your Body and Soul, the healthiest podcast you have ever heard in your entire life. We're based here at Neighborhood Medical Center on location with my friend here. And I'm getting into the introduction, but on location here at the Lincoln Neighborhood Center. We do want to say thank you to the Lincoln Neighborhood Center for being a great partner for Neighborhood Medical Center. We're able to serve our community in a great capacity here, so thank you to the Lincoln Neighborhood Center. Today I have a great friend, somebody that has been a silent but deadly impact. Now, he was a great impact. He's been a great impact on my life, on our Leadership Tallahassee class, and just anybody who comes in contact with him. He's quiet, but he's effective. Mr. Ryan Smith. How you doing, my friend?
Thank you, sir. I appreciate the opportunity to speak to you all today.
No, look, the pleasure is all ours. You are a dynamic and a phenomenal person. I'm going to do all the bragging for you. From now on, I'm just going everywhere with you and just do all the bragging for you because especially I want to give you your props. Our last Leadership Tallahassee Day, we got a chance to go and visit TMH, visit all the hospitals, but especially visiting TMH.
Yes, sir.
And you stepped in, you took charge, and you were comfortable. You were in your element, and it was great to see you be able to be in your element and just come alive and just show us how you do your job and do what you do.
Thank you, sir.
So, can you give our audience a brief introduction of yourself and what you do and how you help Tallahassee Memorial HealthCare?
Absolutely. Thank you. Ryan Smith, I am the Chief Nursing Officer at Tallahassee Memorial. I actually started as a new graduate back in 2008 at TMH. I come from a military family. That's part of the structure that I was born and raised in. I come from a divorced family. To me, I say it's the best thing that ever happened to me.
Right.
My father, military, so during the summers got to travel around the world. California, lived in Panama Canal, so got to really experience the whole world, but had the stability during school years to stay with my mom in Columbus, Georgia.
Gotcha.
So went to nursing school there. My dad is a PA, my mom radiology director, stepdad director of EMS. So healthcare is all I knew.
Yeah.
And it was really what field did I want to go into, and what career did I want to choose. And there's actually credit to my parents who said, go into nursing. It's the most diverse field.
Right.
You could enter the nursing field, you go into leadership, you go to advanced practice, but you can really make a difference.
Right.
As a typical male, and that's stereotypical.
Right.
That was the turning point where you did not see as many males in the profession when I went to school. But upon graduation, I think we had a class of 50 and we had 3 or 4 males. Typical male wanted to go into emergency services, wanted to work in a large academic trauma center, didn't have any relation really with Tallahassee.
Right.
I just wanted to be in a place that saw a lot of trauma patients, care for the community, and was fortunate enough to apply here at TMH.
Gotcha.
Back then, and was hired as a new graduate. It has been the best thing for me. It's been a great career move. I have a lot of respect for what TMH means to the community, what we do for the community. And I really drive home that TMH, the difference that, and what keeps me here is it is a not-for-profit, private asset of our community. And the decision making is local. We're not corporate. We don't have corporate structure that we have to go, provide insight to make decisions. That we have the ability to make changes here. Our board of governors are local. It is an incredible community asset here.
Right.
Current capacity serve as the chief clinical officer. Have the opportunity to serve, and oversee about 1,500 colleagues there on the nursing front, radiology, respiratory, laboratory, pharmacy. And just very blessed to do so.
You do a lot. You do a lot. So no, but your story, your upbringing is incredible. So as a male going into nursing, how did you block out, let's say, naysayers or people trying to say, hey, you're a man, why are you going to nursing? How were you able to block that out?
Yeah, so for me, it's interesting. It's what is your calling? For me, it's as long as you're pure to why you're doing something, then you follow that passion. And for me, it was, I want to make a difference. I want to make a difference in the patients and the families that we take care of.
Right.
And that was natural to me.
Gotcha.
In leadership, same philosophy, that now in a direct care role, you have the opportunity to make a difference for 4, 6, 7, 8 patients a day in the ER. Well, in leadership, now you have the opportunity to make, the difference in all of the colleagues that you serve and all the patients that you serve. So for me, I never really, I just follow my passion and, put my head down and work and be pure and do what's right. And, it's always worked for me.
Yeah, no, I think that's great because some people have a hard time finding that passion, but even your parents helped you find your passion, and it was something that has been a part of you and been with you for a while. So now looking back on your decision, how do you feel about your overall decision, but also the journey that it took to get where you are now?
I love it. I never thought I would be a formal leadership track. I thought I would go into nursing and follow my parents' career paths, which have been, advanced practice or do something to that nature, and just really grew a passion for leadership.
Yes.
And, I think that my whole life journey with, the situation that we talked about with my family and the military structure and the divorce family,
Right.
Really made me humble and recognize, my past. Also am a big team sports guy where grew up playing competitive hockey, and I feel that, in leadership, team sports is what builds character around leadership. It's just natural to me, and I've always been put one foot in front of another, the right things happen. Control the variables that you control, do what's right, be pure, be intentional, and things take care of themselves. The journey is hard. Leadership is tough.
Yes.
There's a quote out there that, the only person you can control is yourself. Well, leadership is controlling all variables that you can't control.
Exactly.
So why would anybody want to do this?
Right.
But when you can see that difference that you make, and you can see the impact that we all make and have a great team, it pays dividends. It's worthwhile.
Right. So speaking of leadership, because that's something both of us, we're currently in a role to develop more as leaders, but how do you use your leadership role to help shape the nursing culture and improve the nursing culture at TMH?
So, firm believer that be pure, and I'm in leadership not because of my title, not because of my salary. I'm in leadership to make a difference. And, I think when you come with that pureness, I think people will recognize that.
Yeah.
Being a new graduate here, I feel like Tallahassee is my home. I feel like TMH is always my home.
Right.
I've never been other places in the healthcare industry to work. I've of course come from a healthcare background, but this is my first employment here. And I think there's a relatable factor that when you speak with nursing, they understand that you grew up here, you see the professional advancement, you see the career growth, they see what TMH stands for. And I think if you carry that with you each day, people recognize and see that, and you have respect of your colleagues. And I won't ask anybody to do anything that I won't do.
But that is the greatest part. Come from a team background myself. My parents divorced when I was 5, so similar backgrounds. Football was my sport, and there's a I think it was an old Packers versus Seahawks game. The Seahawks kicked the Packers. I think the Packers were up. The Seahawks kicked the onside kick. One person for the Packers. His job wasn't to go for the ball. His job was to knock the person out in front of him so the receiver behind him could get the ball. He didn't do his job.
Oh, yeah?
The Seahawks recovered the ball. The Packers lost. And so I use that as an analogy for my life. Stay in your lane and do your part. Do your job. If my job is to sweep the floors, I have no business on the roof trying to blow the roof off because that's not my position. And you're so right when it comes to teamwork and being on the team. Everybody plays a specific position for a reason, and that doesn't mean you can't do these other positions, but you're in this one for a reason. If we all play our positions, then we'll be great.
Couldn't agree with you more.
Yeah.
Every role is critical.
Yeah.
Do the best you can, put forth the effort. If everybody executes on their role, everything works.
Right. But also developing ourselves in healthcare and being a team player in healthcare, because if this is the margin of error, if it goes wrong, and it goes wrong for a patient.
Correct.
So we have to make sure that we are on the same page and working together.
Absolutely.
Yeah. And so using that, how do you use that to create a supportive environment, not just for yourself, but for the nursing team that you have?
I think it's staying humble to the fact that I'm in administration now. I oversee 1,500 colleagues. You can't oversee every aspect of everything that goes on. And my passion and my love is being upstairs and seeing what's going on and supporting the colleagues and being relatable. And you have to be cognizant that when regulatory changes come or changes to our EMR system, whatever it may be, what is the impact that it has on our staff?
Right.
And you have to understand that. You can't force things down people's throat that you don't understand the cause and effects of.
Right.
So for me, it's understanding the cause effects of everything that we do and being intentional about that and doing our research about that, and having a balanced approach to what can we do to make this supportive to you, but this is also a way to do from the regulatory side, and having a negotiation with colleagues, with staff, with other leaders to come up with the end goal. Here's our end unified goal. How do we reach that? But understanding all sides,
Gotcha.
Listening, understanding, looking at data, knowing how systems work. And to me, that's how I'm supportive to them.
Right.
Because I could speak on both sides of the fence.
Gotcha. And so how have you noticed your team has responded to your leadership style?
They will say I'm very fiery, that I have very high expectations,
Yeah.
which is funny because Joe and I were talking about how introverted I am in leadership Tallahassee. And I'll tell you, Joe is an incredible asset. I've gained a lot of respect for him. Neighborhood Clinic is very blessed to have him here and in our Tallahassee community as well.
I appreciate you.
He is somebody I have a tremendous amount of respect for. For me, you have to have expectations.
Yes.
And, it's nothing personal for me. And I think they've grown to understand that my expectations are around what's right for patients, what's right for our families, what's right for our colleagues.
Right.
And you can't waver from that.
Right.
And, we want people on our leadership team that it's not about them, it's about the bigger cause. So the leadership selection is key to me, and finding those leaders with that same passion that will work tirelessly to do what's right is key. And I think when you build that, then you start seeing high functioning teams.
Right. Yeah. So in addition to that, building a team, because in leadership, you're charged with building a team. People come, people go. So you have the philosophy that you have a teamwork philosophy. You have a philosophy of making sure you put your best foot forward to get better, to make sure you get better as a leader, make sure your employees get better. So how do you go about choosing the right people to fit your team, but also to not just fit the philosophy, but to enhance the philosophy?
Absolutely. I've learned a lot at TMH. I've learned a lot through leadership. A leadership team should reflect the community. Mm-hmm. So having diversity amongst the team is important.
Right.
Have different experience, whether that's external is important. What are my opportunities when I look at it? My challenges or opportunities are I've grown up in the system. What are other systems doing?
Right.
So when you're looking at your team, what critical roles do you need to look at for external? Who do we need to bring in that's external? Other experiences, where are we trying to go? Mm-hmm. What type of race and culture and other things that we need on our team to reflect the community, reflect the patients and the colleagues that we serve, but what also type of backgrounds and degrees that we look at as well. Historically nursing has been very nursing centric in degrees. We have an industrial engineer on our team who's a master black belt, has a PhD in project management.
That's great.
And it's cool,
Yeah.
and he provides methodical structure and data and analytics and, just a different view of what we've historically done.
Yeah.
So when you have an opportunity to look at your team and say, we're either adding or expanding or, somebody grows and develops, which happens all the time, doing an assessment to say, here's where our opportunities, here's our gaps, and pre-planning it to say, this is the type of leader that I need, whether it's an operator, whether it's a personnel, what type of background. And to me, that's important, and that's what we look at.
Man, between you and Sham, these nurses are in good hands. Because as I say that, I'm thinking about, we get a chance to work with FAMU and FSU nursing students. And as a matter of fact, this Thursday, we're going to be working with FSU nursing students. But seeing some of the things that they have to go through, but also knowing some of the professors and knowing the high expectations and the excellence that they're expected to have. Mm-hmm. But I could see a great path of those, let's say a student from either FAMU or FSU to come work at TMH. Absolutely. And they're working under you. They're going to get better. They're going to grow because that's the tone that you've set for them. That's the tone you've set for TMH. So, but that makes me feel good. And I'm sure people who will see this, because if you ever have to go to TMH and you need services and you need care, we know that the nurses they already know you have to come in and give your 100% because you're giving your 100%.
Absolutely.
Yeah, so we appreciate that.
Thank you.
So we're now in a time, it's 2020, so this technology is coming around. This technology can either help you or hurt you depending on your perception of it. But how has TMH and your nursing department been able to incorporate the technology to enhance what you guys do?
So everything is technology driven. There's good and bad parts of that. And, we hear from nurses that, the good part is there's efficiencies, there's macro data, there's things that you can look at and trends you can look at due to technology and data.
Yeah.
Everything in technology is gathering data. And when you look at improvements and optimization, the data is there, which is awesome. The fallback, though, is every time you integrate technology, and what the technology we see today is it requires manual clicks, steps, etc.
Yeah.
And it takes away time from the bedside.
Gotcha.
So we watched our nursing workforce, be that hands-on, to be that compassionate caregiver at the bedside, to doing that as well as balancing documentation and balancing all the requirements with technology. I think that's something that we're still looking at and evolving. I will tell you there's some cool technology on the forefront that has us very excited. You see it more on the physician side today where you have voice recognition technology, where all the requirements that we're looking at in our EMR and putting in the manual plugs, that voice recognition automates and makes maximum efficiency of what nurses do. You're going to see that cutting edge technology in the nursing side. We're going to a new EMR, which is going to significantly reduce and enhance our ability to take care of patients and reduce the time that we spend in front of computers. You're seeing some telemedicine technology that's on the forefronts. You saw it during COVID. You hear it. If you have a question for me about where the healthcare is going in the future, we'll talk about that in a minute. I'll save that one there. But there's some really, really healthcare generational changes that are coming with technology. And the hospital that I'm a firm believer in this, the hospital that you see today will not be the hospital that you see in 10 or 15 years.
I'm excited about it because my analogy is you can either look at, especially AI, you can either look at AI as if you're an iRobot, or you can look at AI as if you're the Avengers of Tony Stark or Black Panther and you're using it to enhance yourself, or you're looking at it as if it's the enemy, because that's where we're moving.
It is.
And we've even started incorporating AI in some of the things that we do here in our outreach because it actually helps us reach more people. But with this, it's helping with the patients.
Absolutely.
But one thing you mentioned, though, the bedside stuff, that's still going to be face to face.
Absolutely.
So, you have experience doing bedside, and now in this position. So, how do you communicate your bedside expectations to your staff to make sure that the patient is getting the best care that they can get?
I will tell you that's the, and I'm a millennial, so I'll say it. From a generational side of things, the biggest challenge I think we're faced with is not the technical skills you see in nursing. We have incredible colleges and universities around here. All the colleges that we know and we work with in Tallahassee and our surrounding counties, they do an incredible job training nurses. Technically, they're incredible. Hands down, put them against anybody in the country.
Yeah.
The challenge, though, is, and one of the things that we spend a lot of time with speaking with the deans, is that interpersonal skills. And that communication of how do you engage, how do you look somebody in the eye, how do you approach, how do you have hard conversations. We spend a lot of time in didactic sessions, developing nurses to have those interpersonal skills, because there's a natural migration towards the technology and the computers, and we're actually training you in the verse.
Yes.
You excel in that. We need you to work on the interpersonal skills. And I think that key is I think that piece is key. We're not perfect at it. Nobody is perfect at it. But I think that is the biggest gap of how do you communicate and how do you have that natural, non-technology interface between the caregiver and the patient and the family.
And the generation does matter because we grew up in a time where our parents made us go outside.
Oh, absolutely.
We had to interact with other people. I was telling our intern, when I was in college, we only knew what was going on in Tallahassee. We knew Florida State because we could drive over there, but we know nothing in these other places because there's no way to communicate. But now, it's strange because we have more ways to communicate, but the ability to communicate has been stunted.
it's so much overload that,
Yeah.
that the data overload and everything's data. So
Right.
the, social media, the news is so overload that you don't have to, I think to your point, you don't have to talk to anybody anymore.
Right.
Everything is right there in your hand.
Right.
And you get all the information you need.
Exactly. And it's a good tool, but it seems like it stifled us a bit because those no matter what, you need those interpersonal skills.
100%.
Yeah. So collaboration, community collaboration. Neighborhood Medical Center would be nothing without our community partners, especially like the Lincoln Neighborhood Center here and just the Frenchtown community, TMH. I was born at TMH, by the way, so I have a bias towards TMH. But how do you collaborate with other community partners?
Yeah, so I mean, I think it's for us is what is the need of the community. We saw it during COVID, whether that's testing centers and standing up at the Northwood Mall and what was done there. When a crisis happens,
I was there. Yes.
you were there.
Yes.
We respond, and it is. We all have a great relationship with Tallahassee. Tallahassee is a relationship-based community.
Yes.
Period.
Yes.
And that's what we're the large Mayberry, as people say.
Yeah.
We know everybody here. We have relationships across the pages. And I think that's natural for us. And the thing that I will, brag about TMH is we do what's right for the community. And we're not perfect. We always have opportunities. So I don't want to take this away that everything is fantastic. But we do a lot of things incredibly well. And our purpose is spot on that, we do things for the community, whether that's opening urgent care in Frenchtown, whether that's, collaborating with, a pandemic and a crisis that happens, whether that's looking at a service that says, we're a comprehensive stroke center,
Right.
and we take patients from, a 200-mile radius and, what are the needs that we need to meet, and our goal is to meet those needs to care for our
Right.
community. And we listen, feedback. It's feedback from our community. It's looking at the data. It's, the same governance that we talked about of having a board that reflects your community.
Right.
So when there are gaps that we see, we constantly get feedback from individuals in the community and data to say, here's what we need to respond to, and here's how we collaborate to get it done.
Gotcha. So what about collaboration within the hospital? Because nurses are some of the most important pieces. So how do you preach collaboration within the hospital?
Yeah, so to me, it starts at the top. That, people as myself, I have great peers. We have a great CEO, Mark O'Brien. He's been in this community since 2002.
Yeah.
Like, that's unheard of in healthcare today. But when you speak to him, you hear his passion, you understand his purpose. When you talk to my peers, the executive team, that, we all have a unified focus of, taking care of this community, taking care of our patients. So I think the collaboration starts with, we have to be aligned. Our medical staff is incredible.
Yeah.
Dr. Frall, Dr. Watson, who many of you know.
Yes.
The power of nursing and the power of medical staff and the power of all of our clinicians has to be aligned, as you alluded to. And it starts with us as leadership to make sure that we're on the same page. And when we do so, it then trickles down to our other leaders, to our staff. And it come down to very simply, what are we doing? Why are we doing it? And what change do we want to make an impact?
Right.
And when we align on those things, powerful things happen.
And because I look at it compared to how we work here, our medical assistants, they like the skeleton of this thing.
Oh, yeah?
Without them, we falling apart. And we have to collaborate with our medical assistants, especially on our Ryan White HIV/AIDS team. Our medical assistant is the person who preps the patient and works with the physician and just does everything after that. And so we're making sure on our end we go out and get as much information so we can get it to our medical assistant, so we can get it to our provider. And it's just that if it's not working right, then the patient will end up suffering.
Absolutely.
So we want to make sure that our patients are in a good spot.
It's very simple.
Yeah.
Point it back to the patient.
Yeah.
And as you said earlier, everybody has a function, and the
Right.
function is intended to make the system work. And when you have a kink in that wheel, or you have a chain that's broken, it impacts the whole system.
Right.
Everybody has a purpose.
Yes.
Execute the
Yes.
purpose, and the system functions.
Yes. So sometimes there can be a bit disruption in the system, and it come in the form of change, and change could be either good or bad. So can you share some instances where a change happened. Of course, we know COVID might be one great, but a change happened, and you guys had to make sure that you adapt to the change to be able to not fall behind, but continue to get better.
Yeah, absolutely. We talk about COVID. I'm sure everybody's sick and tired of hearing COVID, so we're gonna put that one aside. I'm sure you heard many podcasts about COVID, which is the most challenging time that I've experienced in my healthcare.
Yeah.
I'll talk about, I'll brag about our ER leadership, including the administrative leadership, our nurses, clinicians, radiology, laboratory, physicians. Back in 2019, if you hear about the Bixler Emergency Center, you've always heard the amount of critical patient that it sees, the trauma patient that it sees. I will tell you that's the most active trauma center in the state.
See, I had no idea. So from my view, of course, learning from what you see on TV, you think that people may go to the emergency room maybe once or twice or whatever. You don't really conceive it just like being busy all day, but you have to think about it's a business. It's busy all day.
It is. It is wild when you look at the critical patients and the complexity of what we're doing in healthcare, traumas and strokes and heart attacks and all of these things, and then you add the volume on top of it. And you have facilities that were built. The ER in the Bixler was built 22 years ago. It was built for demand back then with some growth. We've now scaled that. But one of the changes that occurred was we historically, you heard in the community, and we've heard and talk about how do you listen to the community and how do you respond, challenges with wait time. And, when you go to the ER and the Bixler, you get very high quality care. You have great physicians, you have great clinicians, but the wait times are extended. And we knew we had to look at the system and create a different model. And kudos to our leadership, kudos to our medical staff. They went out and they challenged, us as administrators to say, we know we have to do something different. We know we need to go in different communities. They went to Jacksonville, South Florida, and they created a model of a pod. And there was a rotation where you have a doc in each pod. You have clinicians that no longer are assigned to an individual room. They all work together with each other. They have to make sure that they coordinate and communicate clearly because you're dealing with critical information. And doing that alone created a results pending lounge where you come in and you need a lab, just a lab work. You need a CT scan, but you're stable. You can ambulate. You can walk. Historically, you spent 3 hours in that room, waiting for that CT, waiting for that read to happen. And there's another patient waiting in the waiting room that couldn't occupy that room. Well, they created this lounge where you can move that patient from point A to point B over here, refill that room over here, have a clinician over here in the lounge overseeing.
Gotcha.
And due to this creativity, they just overnight, and it was just remarkable to look at the data, overnight just changed the throughput metrics, changed our left without being seen, the amount of patients that left without seeing a provider.
Right.
But the change was huge.
Yeah.
It was big.
Yeah.
But the success around that change was, why are we doing it? The communication that was there, our leaders rolled up their sleeves, our medical staff rolled up their sleeves, they embraced it, they were positive, but they kept it to the point of, we're doing this because of our patients.
Right.
And when you do that, things happen.
But no, and that's great, and people need to hear that because the narratives and old narratives that have always been around, you're gonna go to the emergency room, you're gonna sit 3 hours, and it was like that at one point, but you're telling us that you guys implemented a new system to cut down on that time. So when we can get people in and get people out in a reasonable amount of time. Absolutely.
And there are days, and just not to, I'm always honest and transparent to fault. There's days that we're at capacity. And there's season that we're at capacity. We're in flu and we're in COVID season.
Things happen.
They're not, all days are perfect, but when you look at where we were 3 years ago to where we're at now, huge strides.
Yes. But that's the key though. That's the point, to be able to improve on things. And because that goes back, you talked about one of your staff members being the development.
The Lean Six Sigma Black Belt, the industrial engineer.
Exactly. So having somebody on your staff like that, because I have my green belt on Lean Six Sigma. So the way I'm always looking at, how can we improve on this and tweak this and tweak this? So having somebody on your staff like that to have that vision.
Data is everything.
Yes.
Data is everything. There's a quote that, I'm a big quote guy and micro learner type of person, a Deming quote. In God we trust, everybody else bring data.
There you go. But that's real though, because data helps for us to look at the trends and be able to see what improvements we need to make.
Absolutely.
All right. So we talked earlier about your educational background and also talked about nursing students and different students that will have a chance to come into the nursing profession.
Right.
How do you guys at TMH, how do you handle continuing education for your staff, for those, especially those who show the will to want to learn more?
Yeah, I think there's two ways to answer this question. One, from a clinical side of, what is I think when you meet with students, what is their end goal? Mm-hmm. Is it to be advanced practice? Or is it like me, where I say, I want to be advanced practice and then I migrate over to leadership, just naturally, organically. But what is the end goal? And there's always opportunities. I will tell you, our medical staff's incredible. Mm-hmm. And I think that's a key differentiator here, that, our medical staff are local. Many of them gone to, FSU School of Medicine here. They've done their training here. Many of them are employed or under a contract here. There's opportunities from our nurses, our clinicians, to learn from our medical staff. They pour back into us. And as do I want to go to emergency medicine? Do I want to go to critical care? We have certifications, we have training, we have degrees around that. And then from the leadership side, I will tell you, and this is controversial, I will say that I'm not a big degree person. I have 2 master's degrees. I have them because, one, this is a requirement of my job. Right. But the other part is, I think in leadership, you have natural tendencies and you have qualities that you can't learn in degrees. And not saying degrees are not important, because you and I have learned a lot in degrees. Right. But you pick individuals that have that natural ability, and you support them through professional advancement and growth, and you see things flourish. And I will tell you, we have leaders at TMH, and this is one of the things that I'm proud of, at TMH, is that has associate degrees, and you would never know. We have leaders that have doctorate degrees, and you can't see the difference between the two. And to me, it's about the character of that person that rises.
But that's what I'm talking about. That's the proper environment for somebody to develop in. Mm-hmm. Having a degree is good, like you say, it is good. But if that's the only requirement that you need, you're gonna miss a lot of talent and a lot of people. Like I said, natural abilities. Some people who have been in leadership positions all their life, because there are some people who get placed in leadership who are not leaders. Absolutely. But that's where the continuing education comes to help develop that. And those who naturally have it, they still need development as well. Correct. Yeah. So, all right. Now, I know we back to this, but COVID-19. COVID messed a lot of stuff up, and it stifled a lot of stuff. The world changed. It did. I know we were in a leadership training that we did at that time. The thing was, this is the new normal that we're in now. So all these challenges, all these things happened. The world stopped. The world started back. The world stopped. We had to do the COVID testing center at Northwood Mall. How did you, as an individual and your staff, how were y'all able to just adapt to what was going on? It was probably the roughest time in my leadership career. Yeah. I was VP, Chief Clinical Officer, summer of 2019. I was promoted. Yes. Had a leadership track. Oh, so that's you beginning this. So. Oh man. Summer of 2019, July 2019, promoted to my role. Before, and I will tell you, I always took advantage of, having that one up. Yeah. That pressure and that burden always responds and falls on them. Well, that was me in 2019, exactly. So that was me this summer, and I distinctly remember sitting in our boardroom, and our director of infection prevention came over and said, this virus that's coming out of China, and it could be real. And this was December of 2020, and I'm like, sure, and blew it off like everybody else, right? Or 2019, I think it was, and sure, okay. Well, then it hit. And, I remember I was sitting there when the first patient that was positive came to Tallahassee, came to, here, put eyes on it. We didn't know, was this Ebola? Was this something? Right. We didn't know the cause and effect. We were all dressed in spacesuits. It was wild to look back at the times then. Yeah. And then to look at the evolution of this virus, and go back to, leadership, asking people, we turned our units into negative airflow units. Yeah. We donned and doffed and, looked like spacesuits and N95 mask and gloves. And, we asked
our clinicians to step up the plate, to sit behind those walls and go in that environment, 12 hours a day in shifts. And, you couldn't even take off, you couldn't even go to the bathroom without taking all this off.
Right.
Part of, what I did was, I can't ask anybody to do that if I didn't do it myself. I went in there with them, and I took shifts and helped run. And the only thing that kept me through that was, in those segments, in that crisis, you put one foot in the front of another. You take 1 minute at a time. You could live day to day, and you hope that, and hope's a strategy at that point, that, things change. And fortunately, what we can see is and hopefully it doesn't change, and nobody can predict the future, but the virus mutation that we see today is completely different than what we saw in the beginning of the pandemic. That it's more of a flu-like symptom. You don't see the respiratory effect that we once did. But I'll tell you, it was real. And I took care of patients that, unfortunately, that were talking, breathing, that were using, breathing devices that were perfectly intact and hemodynamically stable. And as soon as you remove that device from them, they passed away. And it was heartbreaking to see. And those things still stick with you.
So how have you been able to get the help or be able to decompress? Because like me, if it's a day, I have to tell somebody, especially a teenager, that they're HIV positive. That affects the rest of my day. And I have to find a way to decompress and kind of get my mind off it. So how were you able to find something healthy, a healthy outlet for yourself?
Go back to sports. So for me, it's family, two wonderful kids. I think that always helps. Go back to playing competitive sports. So, played hockey. Still try to play hockey. You take your mind off of that. In that regard, at work, you have your wins and your losses, unfortunately. Even the best attempt that you made, which we all did. There's nothing that we could do. And I think that was we heard a lot of nurses during that pandemic and physicians that said, we were trained to save folks. That's what we were trained to do. And this is a disease that when you reach this, virus type, we couldn't save you. There's nothing we could do. We all feel like failures. But you also have to take a step back and go, I could, confidently acknowledge that I did the best I can. And, what I'm doing is right. And then you look at the wins. Who did we save? Who did we impact? What is the positive thing that was made? And just take a moment to reflect and go, although this is a horrible tragedy, here's what we did on this side. As preventive, here's what we're doing on the prevention side to prevent from me having to go tell another individual that they have HIV or AIDS, that it all makes it worthwhile.
Exactly. Yeah, it does. Because, on the outside looking in, it seems like it's just a whole mountain that you can't get over. But when you're doing it, you're constantly coming up with new ways to get better, to get to this end goal, to help the patients. Because our thing is, I want a patient to come in, because our job is to find HIV positive. So we find the person who's positive, we tell them that they're positive, we get them into care. And even though I just told them they're positive, their self-confidence and their self-esteem and how they feel about themselves has enhanced, has increased, even though I just told you this diagnosis, because we're going to help you get better. And we're not just showing you the resources, but we're going to grab your hand and take you to these resources and show you that your future can be better.
Absolutely.
So but I love that, man, but I love your passion for what you do.
Thank you.
Because like I said, it showed that day we were at TMH, our last program day, and just being able to watch you and following you throughout and you explaining everything, I was like, man, that's my friend. That's my friend. Yes.
Thank you.
No problem, man. So what's next for yourself and what's next for TMH?
For me, it's do the right thing, put one foot in front of another. That's what I live by. The right thing will happen. I've been very blessed at TMH, very blessed in my career, and that's what I live by each day. TMH, I will tell you, there's a lot of incredible things going on. There's a lot. There's expansion out to the west. Our goal and our long-term goal is we want to remain a community asset. We want to be here. We want to have local governance. We don't want a corporate system. That is key to us. We don't want decision-making in St. Louis and Nashville or any other place. We want to reflect our community. We want to hear from our community. We want to make changes around what we need to make. So we're very passionate about that. We're relentless about that. That's one of the things that we won't waver on. So that is key.
Right.
In order to do that, though, you have to, this is this is a business, so you have to protect your market as well.
Right.
And part of that protection of the market is expansion. And we're looking at expanding we are expanding into the Panama City market.
Okay.
If you don't know, that development over there, that is supposed to be the new next Orlando Center, St. Joe, those incredible folks, they have a retirement community over there that's supposed to occupy 300,000 new residents in that area.
Right. So that's kind of some part of the conversation that we're having at TMH. We're talking about being able to use the FSU Center to be able to expand the name.
Yep. So there's a great collaboration with FSU.
Right.
And what FSU Health looks like. There's a lot of very incredible people right now sitting behind closed doors talking about what that looks like and what that structure looks like in FSU Health. And you look at education and research and how do we continue to advance that quality of healthcare. It comes through an academia partner such as FSU, and it comes through a healthcare institution such as TMH.
Gotcha.
So the cutting edges are huge. And then just the evolution changes that are coming in healthcare. I'm a firm believer, as well as our leadership team, speaking to Mark and others, that today's world of what we see in the hospital won't be what we see in 10 or 15 years. That, hospital and home will be big, and technology that you speak to about how to monitor critical patients at home in their own environment that is cheaper, that's more efficient, that's going to become the future.
That's good.
And hospitals will be a huge critical care or step down units that the lower acuity volume that they have historically been able to care for. We're seeing a lot of that will migrate to the home setting.
Good. Now, what's great about this interview is getting a realistic view of yourself, your position, but what the hospital does and the visions of the hospital. Like I say, narratives, they can travel far, but especially perceptions that we can develop through media. Especially if you maybe watch this TV show or that TV show, so you like all hospitals run like this or all sheriff offices run like this. But I appreciate this insight because you're showing us not only your passion, but you're reflecting the passion of your staff at TMH.
Yes, sir.
And I can tell that because we know people who don't like their job, but you got a great team. You love what you do. You love your patients. You love the people around you. So congratulations, man.
Thank you.
Congratulations on everything. The Vice President and Chief Nursing Officer. That's amazing. So when you got promoted to the position, like how did you react? What was going through your mind?
Scared to death.
Yeah.
So I'm very humble. Put one foot in front of another. And I think that I don't do what I do for me.
Yeah.
And I think that when you're in a position of that much influence, I think is the right term, that you have to be humble and you have to sit there and go, the world sits on your shoulders, right? So most people would celebrate, and I'm happy and I'm very appreciative. So I don't want to be taking this the wrong way. But they're also, I don't take for granted that the responsibility that I have.
See, you're like me. Coming over the neighborhood when I got this position, I'm confident in what I can do in HIVs. I've been working in it for long enough, but it's like, oh man, I'm still like, oh man, what am I going to do this and do next, and how am I going to do this? Because even with leadership Tallahassee, it's going in. But I just think it's part of our process, though. I love, like you, I love what I do. You love what you do. You're great at what you do, but you're always looking to get better. You're always making sure that you are not being egotistical about what's going on. Like, your abilities, but
Be humble.
Yeah, I don't have to go around bragging to the world all the time.
Be humble.
Sometimes, but not all the time.
Be humble.
There you go. So now, I once again, I appreciate you. I appreciate the sit down. Appreciate learning about you, your background, how you work at TMH, how TMH actually works, and the intricacies, but the teamwork and all the ideologies that go into TMH and being better, and your staff being better. And I just thank you for that, but also your mindset for leadership and your mindset for getting better. And that makes me a lot more confident, and of course our viewers are going to be a lot more confident in your staff and TMH as well. So for those who see this, Barack Obama, Oprah, somebody might see this interview and they want to contact you. How can people, what's a good way that people get in contact with you?
Locally, we're not hard. So
Yeah.
that's the good part about TMH.
Right.
I tell everybody I'm on the ground floor between the cafeteria and the gift shop. So if you know TMH, that's where I'm at. Email ryan.smith@tmh.org. Feel free to contact me.
Yeah.
Happy to help in any way that I can. Love Tallahassee here.
Yes.
Love our community. We have some great people.
Yes.
Joe, so
See, I always tell people Tallahassee will wrap its arms around you. And when it does, you will Tallahassee now. So
absolutely. I appreciate you, sir.
I appreciate
Thank you for the opportunity. Thank
No,
y'all.
Thank you. I told y'all, look, incredible guy. I'm proud to say my roommate,
Yes.
Ryan Smith. So, hey, remember, Mind Your Body and Soul. This is the healthiest podcast you've ever heard. All of our contact information is in the description. Ryan's contact information is in the description. TMH's contact information is in the description. Make sure you go check it out. And stay tuned for our future podcasts. Make sure you check out the last podcast we did with Mr. Chirag Shah and all the things that Neighborhood Medical Center has coming up. So, love you all. Make sure I catch y'all next time.